Hi, I'm Dr. Alexandra Filingeri, registered dietitian, doctor of clinical nutrition, and I'm sitting here with world-renowned plastic surgeon,
Dr. Thomas Romo, a plastic surgeon in New York City. I'm here to introduce you to our new podcast, We Got Your Number.
We are here to break down evidence-based information and real-world experience, and we're going to bring in some of the top experts in the world because
We got your number. How can we improve diabetes treatment in this country?
let's bring in experts and really talk about what supplements actually
Can
help.
we improve our sleep health by using these medications?
How much protein do people really need to
Can
eat?
nutrition solve all of our problems?
What happens if someone comes off their weight loss medications? Welcome to the
We Got Your Number podcast.
Dr. Romo. Let's explain to them how and why we started this podcast.
Well, Ali, the We Got Your Number podcast is going to be an evidence-based discussion, bringing to people the current knowledge that they need to know about health, lifespan, health span, and living a better life.
Yeah. So we have been talking for probably a year about how do we address these unanswered questions? How do we talk about these hot topics in health? And how do we bring facts directly to people? So we thought, why not bring in the experts, right? And have them help us answer questions.
And that what that does is make this concise, but it makes it very interesting. So We Got Your Number podcast, we're going to be talking about, as you said, important topics, particularly about weight loss and obesity and plastic surgery and nutrition and how that will improve our life.
Yeah. So I think that we should, right, just like let the viewers know, how does a world-renowned plastic surgeon join forces with a early on career doctor of clinical nutrition? What is the synergy, right? What are the shared values? So tell me, how did nutrition become an important piece of surgery and your medical practice?
Well, as a plastic surgeon, that's what we're doing is surgery. And surgery is the technical aspect of what we do, but healing is the key. And healing gives you the best result. And healing it requires a nutritional intake. I tell patients all the time that the healing tissue that's making everything heal is not carbohydrates and is not lipid, it's protein. And the data has shown that improved protein intake decreases postoperative infections. It improves postoperative outcomes. It's been shown around the world. So since I'm into the surgical and healing aspect, bringing on and finding a PhD nutritionist like you was just a natural.
Yeah. And I remember actually sitting at my desk. I was working in the hospital. I was sitting in the basement of the hospital. I had a new growing private practice. And I said, you know what? I'm going to message this plastic surgeon because I think that, one, I could learn a lot from him. And two, it opens up the conversation to talk about post-operative healing. But it opened up the conversation to talk about so much more.
Well, that's very true because since we started that conversation several years ago, the GLP-1 market has come in, has taken off, and then all of the diverse health improvements that have occurred and the topics, and that extends to mental health, reproductive health, life health, cardiovascular, sleep. All of those are new topics that now have come to the fore because of these treatments that we were initiated by just trying to improve people's health postoperatively.
Yeah. And we're in the world, right, where the word longevity is everywhere, right? So what does longevity mean in the context of health and wellness, right? We're almost in the Wild West now.
You're right. And that gets back down to something we were talking about earlier, which was lifespan versus health span. I mean, we're all mortal. And I hate to tell you that we're not going to live forever, but you want to feel bad on the day you die. And you want to feel great up until that time.
Right.
And we're going to discuss those topics. How do you improve your health in all aspects, dovetailing in nutrition, but also dovetailing in all the special topics that interface with that.
Yeah. And I think that the interesting piece is we have such different backgrounds, so we bring in very different perspectives, right? So I'm asking you, what is the health side of things? Like, right, what is the medical side of this equation? And you're asking me, Allie, what do I do when, my patient that's 3 years old doesn't want to eat, right? So it's really seeing how two different specialties can kind of come together and give people what sits in the middle, right? It's not just medicine anymore. It's holistic care.
And the topic and the name, we got your number. For a surgeon, that's kind of the world that we live in. So it's very black and white in
Tell
surgery.
me.
You either it's success or it's not a success. So numbers don't lie. We got your number is going to be talking about trying to clear the air of what well, this is what's popular on social media. This is not, but evidence-based medicine. Predicate, and then we bring in the speakers that we're going to have, which are experts in the field, and they can talk to the specificity of we got your number.
Yeah. And there are some they're hot topics, but they're questions that everyone wants the answer to. And this is not just society-wise, but I can think of a few off my head, right? So there's so much questions around how much protein do we need, right? What supplements really do work? How do you navigate life on weight loss medications? And I think understanding that there is an answer, and the answer pause. Okay, right. So that there is an answer and it sits in the evidence. And I think that's what people forget is it's not subjective. It can be very specific. And that's why we decided that we were going to do this.
Exactly right, and that's where the process of we got your number, because we're going to break this down into specifics of why people want this and how these drugs work, but just like any other medication, there are problems with medications. There are complications. And there's a thing we call sequelae, which is the natural process of what occurs with something. And we don't want to forget about that. You don't have to take a pill always to get better. Mm-hmm. You don't have to take a pill to get your blood pressure dropped, and you don't have to take a pill to get thin. If you eat well and you do exercise. So we want to keep the naturalness to this, the reality to this, because we got your number.
Yeah. Now, Dr. Romo, tell me just a little bit about yourself for our viewers. What do you think I know there's a lot, but like maybe the most important things that the viewer knows about you?
Well, the most important things that they need to know about me is that I am obsessed with outcomes. As a surgeon, it's one thing to do surgery, and since I train surgeons, I tell people it's not can you do the surgery, but should you do the surgery. And once you learn, because surgical technique is surgical technique, and then you learn the vagaries of that, and that's why it takes forever to get out of residency and fellowship. But then it's the application of that, and then when you apply the surgery, you want to improve outcomes. And outcomes
Right.
are the success to that. And one of the tremendous successes that you don't learn in med school is nutrition. You don't learn about how important it is for your patients to be able to intake the things they need to do to improve their outcomes. And that's where the synergies with you and I are.
Yeah, so it really comes with what happens when you leave the doctor's office, right?
Yes.
When you've had the surgery, you've had the care, you've been giving the recommendation to gain weight, gain muscle, lose fat, take a supplement, not take a supplement. What happens when the door closes, you leave the doctor's appointment? How do you integrate those changes into your life? And I think that's what people are missing. People are smart in the sense that they can understand, I need to gain weight, I need to lose weight, I need to take supplements, I need to improve my healing post-surgery. But where they lapse is they don't understand how to take those complex topics and integrate it into their daily life. And I think that that's the benefit. If we can help explain how do you get your result and how do you integrate these changes into your day-to-day, that's when people will see success.
And that's very true. And on the corollary is that John Q. Public is routinely lazy. And so most people are looking for the easiest outcome. How do I do this? we've known since aerobics was introduced into the United States and the world in the 60s. If you got out and ran and if you watched your weight, you would improve your life. Well, that's 50 years, so people haven't been doing that. COVID and working from home totally changed our world, and it's going to change it into the future. And with social media and the influencers, that has changed our world and will continue, as AI will. They can be beneficial if they're applied beneficial. People need a filter, and we hope to act kind of like that filter to help them see what's reality and what's not true as versus to what is being advertised or pushed. We're going to give the evidence-based and show them that we got their number.
Yeah. And it's interesting because we never said on this podcast that we're here to make people feel good, right? We're here to give people advice that they need, right? We're here to make them feel better. And I think that feeling good and feeling better are not the same. And feeling better sometimes takes knowledge and learning and discipline and connecting with the right doctors and the right providers. And that, I think, is the route that we're going to take. We're not just going to sit here and talk about problems, but we're going to talk about how do you change them, right?
Correct. And that's why we're going to bring in some experts to help really make this evidence-based, that their expertise. You can't be an expert in everything. And so that's why you and I got together, bringing together surgical intervention and healing with nutritional supplementation and improving outcomes with that. But there are now, with the world of obesity medications like GLP-1s and the newer ones that we're going to be talking about, the 3Gs that are coming out, the oral medications that are coming out. We want people to hear the truth because there are downsides to these medications. There are complications that can occur that are minor. And then there are big complications that can occur. There's so much money to be made with these medications that even the supply chain got blocked up and compounding came in. Okay,
Yeah.
What are the problems with that? What are the real problems with that? And that's the things that we're going to be discussing on We Got Your Number.
So when we thought to start a podcast, we didn't just, pull ideas out of our head. We've been following the media. So what we did is we gathered some of our favorite titles over the past 6 months. Let's read them. You first.
Okay, I'm going to go first. These are articles in the popular press, and they're out there, and they're having an influence, and we're going to actually show you some of these, actually. Here's one on Ozempic fights cancer. There we go. And these are true. And we're going to actually bring people in to show if these, on our podcast, We Got Your Number, is this real data? Ozempic and the brain effect. They're actually showing it affecting the ability to have a positive modulation on Alzheimer's and dementia, and we want to be able to address those. I'm going to go through two more because I like this one. Ozempic helps up your love life. So we like that one particularly, and this is on what I got to show you. Here's an advertisement for these wonderful medications, and then I flipped it over, and here's the complications. And so I'm wondering how many people read through the complications, particularly if you're doing this through telehealth. Allie, do you have some?
Yeah. So the ones that piqued my interest had to do with supplements, right? So,
Oh, I bet.
and this one's really recent, right? High dose of turmeric supplements nearly killed me. So talking about liver damage. Another really hot topic, which we are definitely going to talk about and bring experts in. Ivanka Trump knows creatine is not just for gym rats. So there's a lot of data right now out on creatine, and there's a lot of data on, who needs creatine? Is it just a women's health supplement? Is it an Alzheimer's supplement? Is it a supplement for bodybuilders, or is there, somehow a connection between all of them? So we're going to address that question. And then we're also seeing data on IVF and pregnancy rates. And we're seeing this data in a few different areas. The first is with proper obesity care management, and how weight loss medications may be the proper course of action pre-fertility treatments. So, I'm seeing articles here on Want Babies. Let's treat the real root cause of infertility. So we're seeing these things in the media. We're seeing weight loss medications. We're seeing supplements. We're seeing fertility, and we're here to kind of address the cross section between all of them.
Absolutely. From a medical end, from a cultural end, from a nutritional end, all of those have an impact. Like we were saying earlier, the the way people are living today is influenced by work from home, culture, social media, things, and now you can just take a pill and lose weight. So why not do that? And why would I run around the block when I can just take a pill? Not knowing the complications, not knowing the normal sequelae. You take a blood pressure pill. The interesting thing is, as a surgeon and as a physician, every medicine that I write for a patient, if you know, we look at the pharmacy or you get them a drug from the pharmacy, it has a packet in there, the details about what the complications are and what the side effects are. And these medicines have the same thing. These are medicines. You're not supposed to get this unless you're a doctor or a nurse practitioner prescribing this stuff. So there are complications, and people need to know that. There are known, what we call sequelae, are just the known processes that also occur with this. And some of that has to do with, of course, nutritional loss and body composition.
I think that's something that's super important, and we're definitely seeing a shift in healthcare is patients are now coming into offices if they're going to see their plastic surgeon or their general MD, or even if they're coming to see their nutrition professional, and they are exposed to the same type of media that we are, right? So they're asking us questions about creatine. They're asking us questions about is our weight loss medications appropriate for IVF? They're asking what type of protein am I supposed to take before surgery, or how do I nutritionally optimize my body to heal post-operatively? And I think that we're now starting to see multiple areas combined into one, and I think that it's really everybody's responsibility to become, well versed in these topics.
And on the corollary or in the addendum to that, there's a lot of money to be made here. Okay.
Yeah.
So you got to when influencers become influencers and continue to do that because they're making money.
Yeah.
So I mean, the validity of what they're saying to you. I mean, who's doing they're not getting polygraphed to see if they're telling the truth or not. They can expand it in any way they want to, and the same way with the media on pushing these drugs and these medications. What is really good for you? What isn't good for you? You have to take responsibility for your own health.
Right.
And then the corollary, the question that you asked me just a minute ago was in pediatrics. So much of this stuff is into the with social media and with what's going on with young women
Yeah.
and culture. I mean, women have always wanted to be thinner. Is thin enough? Can you take a pill to get thinner? You're an expert on all that.
Yeah. So you bring up a few important points. So the first is how much of this culture shift in wellness and health is driven by supplements and the supplement industry and is marketed to people based off of cost, right? And that's something we're going to break down because there is some science and efficacy in some supplementation, while there is, very limited efficacy in other areas. We're going to talk about that.
Correct.
Right?
Mm-hmm.
Same in the sense of we're going to bring in top experts in the world to talk about weight loss medications, right? To answer the question is, how do you do it safely and effectively, right? How do you not end up with, improper management? And then we're seeing that these things cross over into children, right?
Absolutely.
So,
and body composition is one of your big things.
yeah. So, I mean, we can't blindly do anything, right? So it's not smart if it's, weight management or weight loss without weight loss medications or with weight loss medications. It's not smart to blindly say, just lose weight and I'll see you in 6 months. And if you lost weight, maybe you lost muscle, which isn't favorable, or maybe you lost fat mass, which may be favorable, but we don't know unless we're looking in them. And, to be honest, if you're doing a virtual consultation, that's not something you have access to unless you're sending your patient somewhere else.
Well, you can imagine. So I'm a physician, and I've had to take call in the emergency room, and we're on speed dial. So I mean, my patients can get a hold of me. They can get a hold of the residents. And when you talk about these medications, there are the norms that are minimized, like nausea and diarrhea and vomiting and those kinds of things, are not minimal. But compared to something like pancreatitis, pancreatitis can kill you. Um, can you get a hold of your doctor? If it's a telemedicine doctor, now I'm in New York City here, so if I bought my medicine through a telemedicine doctor in Phoenix, and I get pancreatitis and I bend over at night and I'm in chronic pain, you got to be able to. This is an emergency,
Right.
and you have to. So this isn't playtime. This is real time, and those are the things that we're going to address with "We Got Your Number."